pada tanggal 9 April 2016 bertempat di JS Luansa Hotel Kuningan, Jakarta, diselenggarakan Simposium Indonesian Wound Summit yang dihadiri oleh 180 peserta dari berbagai spesialisasi. Event yang merupakan rangkaian dari Kalbe Akademia ini menghadirkan topik-topik yang menarik mengenai perawatan luka. Simposium ini diisi oleh pembicara kelas internasional seperti Dr. Bunyamin Setiawan, PhD, Dr. Ian Gordon, PhD, dan Profesor Dr. David Perdana Kusuma, spesialis bedah plastik konsultan.
Does the problem of wound poses to our healthcare?
Well, in our older patients, it's a very serious problem. Diabetic patients, the number one reason a diabetic patient comes into the hospital is an infection in their foot started by a wound, originating in a wound that hadn't healed. And in older people, wounds of the leg are very common and cause a lot of pain. They're expensive to treat. They require a lot of resources from the healthcare system to manage. So it's not a small problem, and Indonesia is not alone. The whole world is seeing this as people get older, as obesity is a problem, smoking is a problem, diabetes is the number one problem that creates wound issues. And one of the problems is Indonesia has a lot of diabetic people. It's a problem in Southeast Asia. So you're not alone in the world. You're like many other countries just starting to deal with the problem of chronic wounds in older patients.
Thank you. So basically Indonesia is also have a high prevalence of diabetes and a high risk for developing wound problems. And also we here in Indonesia are starting to learn more about wound care, and newer wound dressings such as silver and other wound dressings are relatively new here in Indonesia. Most of us are still unfamiliar, and we are still learning, just like what we did today in the Indonesian Wound Summit. But some of the practitioners here consider the newer dressings are relatively expensive and unaffordable. But could, from your perspective, could the use of the choice of dressing, can it actually reduce the cost, or does it increases the cost of care of patient?
The cost of caring for a wound is not just one dressing, how much it costs. It's how long will the wound take to heal, or will it heal at all? So if you look at it from the point of view of the cost to the system, is every visit to a clinic, every admission to hospital, the patient loses their foot from infection. Using a silver or iodine-based dressing that leads to faster healing or saves a foot is very economical. So it's a mistake to look at it as, what's the cost of this wound? I could use dry gauze and it would save money. It'll save money in the short term, cost a lot more in the long term. I also have to make one point. It's not, the most important thing in wound care is not what you put on the wound. It's, do you treat the underlying cause effectively? If you're not treating the underlying cause, which can be poor circulation, it can be infection, or very commonly excess pressure on the wound, you're not going to get that wound to heal. So it's a mistake to put all your faith in, I'm going to use a silver dressing and that'll cure the wound, if you don't use the right shoe, or you don't treat the deformity in the foot of a diabetic. So it's important to have that perspective. The dressings are important. Treating the underlying cause is the most important thing.
Yes. Thank you. So basically, just like we treat the diabetic wounds, we have to treat the diabetes. So basically, we have to look at the cause and treat the cause, and also we have to have a holistic approach. For example, with shoes or with other prosthetics, for example.
Exactly.
Regarding the use of negative pressure, on which patients does negative pressure can has the most benefit?
Well, the best scientific evidence is for diabetic patients with wounds who have surgical debridement. In that case, after the surgical debridement, negative pressure has been shown to be the most effective form of local care. So that's economic and truly leads to saving feet, healing wounds that might otherwise not heal or the foot might be lost. In the setting of acute surgery, acute wounds, surgical incisions that burst, negative pressure is very effective. Other chronic wounds, pressure ulcers, arterial ulcers, are not particularly sensitive to the benefit of negative pressure. Some are. Stage 3 pressure ulcers can do very well with negative pressure if you treat the underlying cause. The thing with venous ulcer patients often require skin grafts. Negative pressure is very effective in preparing the wound for a skin graft, and it's the best dressing to put on top of the skin graft if you do it the right way. So there's a lot of application of negative pressure in many situations, but it's important to also know the situations where it's not helpful. Arterial ulcers, stage 4 pressure ulcers can be maintained but rarely healed with negative pressure.
We are still trying to improve our knowledge and skills in wound care. That is why we are doing this Indonesian Wound Summit. So if I may ask for advice or suggestions to the practitioners in Indonesia, what would you give advice to them?
Well, you have some very smart people. I met them at this meeting, and I have no doubt the knowledge and the expertise exists in Indonesia to build a nationwide program which will improve the management of wounds. And you really should do that given how serious the diabetes problem is in your country. If I had to make a recommendation, it would be have more summits like this, have more training, and encourage different specialists, particularly the surgeons. The plastic surgeons, the orthopedic surgeons, the vascular surgeons have to take the lead in building multidisciplinary teams to treat this difficult problem. It's like cancer. We know in the United States cancer can be cured, but it's not one doctor can do everything. You need surgeons, you need specialists in chemotherapy, and other people to collaborate. Wounds are more expensive. It costs more for a patient with a wound to be admitted to hospital than for a cancer patient to be admitted to hospital. It requires a team approach, and you get the best results when various specialists work as a team rather than one doctor alone.
Thank you. So in conclusion, we should keep collaborating between specialists, and we should keep learning, for example, from workshops and symposiums.
Exactly.
Thank you. Thank you very much, Dr. Gordon. We hope that we can achieve better care for our patients. And good afternoon, and thank you very much.
You're welcome.